Welcome to Knee Rehab Pros by MSM Products. My name is Scott. I've been a physical therapist for about 26 years now, primarily working with knee replacements. And I've seen the full spectrum of rehabilitating a knee. I teach our pre-op class for patients that are scheduled for knee replacements. I see the patients immediately following their surgery in their hospital setting. I had the luxury of working with an orthopedic surgeon a couple of days a week, and so I would see those patients at their 2-week mark and at their 2-month mark and at their year mark, and I've seen all the patterns and kind of understand the full spectrum of rehabilitating a knee. And the one thing I've learned through all that experience is that controlling your swelling and getting full knee range of motion as quickly as you can is the key to a successful knee replacement recovery. So when you are working with a knee replacement, starting on the day of surgery, your number one priority for probably the first couple of weeks is to focus on your motion. You want a knee that will fully straighten so that you don't limp for the rest of your life, and you want a knee that will fully bend so that you can go back to doing everything that you want to do again. We can always make you stronger. We can always improve your endurance and your balance, and if you had some desire to lose weight, we could do that at any point during your recovery. But we have this much time to get your range of motion back, and it is a quickly closing window of opportunity. And the longer we wait to get it, the harder it is to get. So we jump on it right away, and we focus on a program that is specifically designed to fully straighten your knee and to fully bend your knee. And one of the things that we've learned is that if we keep your swelling under control, we make that significantly easier for you. So we elevate. We use a product called an LRU pillow that keeps the leg elevated and keeps their knee straight when they're resting in it. We ice it. We compress it. We ask them to limit the amount of time that their knee hangs down. So when they're sitting, standing, and walking, all of that is okay to do. You're not on bed rest, but you want to limit the amount of time that your leg hangs down, because the longer your leg is down, the more that knee wants to swell up on you. So you want to control your swelling, and you want to focus heavily on getting your knee to fully straighten and getting your knee to fully bend. You want to show up in your doctor's office 10, 14 days later with minimal swelling, a knee that fully straightens, and a knee that fully bends. And then after that, then you can start working on the higher level strengthening, the higher level balance, and getting back to doing the things you want to do again. But if you jump the gun, you're going to swell. And if you swell, you're going to lose your range of motion, and you're probably not going to be as happy with your knee replacement as you could have been. And so we have a lot more videos that will be coming along, but if you're interested in a program like this, you can go over to kneefit5.com, and we've got programs for 11 knee diagnoses, one of those obviously being a total knee replacement, and it certainly will help you. It's helped a lot of our patients. I wish you the best. Thank you for your time.
If you liked this video and found it informative and would like to have further information, please check out our YouTube channel, as we have many informative videos there. Please also subscribe to our video channel, and you'll get weekly updates with new information.